Welcome back to the Angry American. What's up, ladies and germs? Today we're going to cover a fungus. I saw something about a black fungus in India the other day killing a bunch of people. And then yesterday I heard about a fungus in Dallas and maybe DC that's killing people. So we're going to cover this new deadly threat that seems to stack. You go in the hospital for COVID, you got a damn good chance, or anything. You got a damn good chance, not a damn good chance, but you got a chance of getting this. And there's, I don't know that there's a cure for this black fungus. There's two different funguses, one here in the States, and then I don't think they have the same name, but there's one in India, but they're both fungus. So, is that the new superbug? I don't know. Anyway, Centers for Disease Control and Prevention, we're over here on, what is this? Channel 11 somewhere, said Thursday, July 22nd, that they have evidence of an untreatable fungus, spreading at two hospitals, one in two Dallas area hospitals and a Washington, D.C. nursing home. A handful of patients had invasive fungal infections that were impervious to all three major classes of medications, according to the CDC. This is really the first time we've started seeing clustering of resistance in which patients seem to be getting the infections from each other, said the CDC director. The fungus, Candida auris, is a harmful form of yeast that is considered dangerous to hospital and nursing home patients with serious medical problems. It's most deadly when it enters the bloodstream, heart, or brain. Outbreaks in health care facilities have been spurred when the fungus spread through patient contact or on contaminated surfaces. Health officials have sounded alarms for years about the superbug after seeing infections in which commonly used drugs had little effect. In 2019, doctors diagnosed 3 cases in New York that were also resistant to a class of drugs called echinocandins that were considered a last line of defense. In those cases, there was no evidence the infections had spread from patient to patient. Scientists concluded the resistance to the drugs formed during treatment. The new cases did spread, the CDC concluded. Now let's hold on here. I want to show you a quick story. Not that one. This one. Let's watch this quick vid.
Tonight, the CDC says it has evidence of a dangerous fungus that in some cases is untreatable. Nothing more than that. It is linked to 2 deaths, in fact, and 2 North Texas hospitals have seen the fungus spread. Our Brooke Katz's looking into it tonight for us. She's in the CBS DFW studio with some more information on this. What do you know, Brooke?
And Doug, the cases were first seen back in January. The CDC told the Associated Press the outbreak is ongoing and additional infections have been identified since April.
The fungus, Candida auris, was identified in a cluster of 22 patients in 2 Dallas area hospitals. Health officials have not released the names of the facilities. Candida is a yeast that can cause infection if it gets into parts of the body where it doesn't belong, like the bloodstream, heart, or brain. It's usually treated with antifungal medicine, but experts say widespread overuse of those medications created Candida auris. It's known to spread quickly from room to room on people and clothing. It's something health officials have been concerned about for years. Back in 2019, specialists with the CDC started calling for stronger measures to detect and prevent these sorts of infections.
It has the unfortunate capacity of being very, very resistant to some of our antifungals, and it also has a capacity to contaminate the environment and persist in the environment. So it's kind of a double whammy in the infection control world.
Of the 22 Texas patients, 2 appeared to be fully resistant to treatment. Both patients died. They are the first cases of the kind in the state. The CDC's website says cases of Candida auris have been increasing during the pandemic, with outbreaks reported in COVID-19 units of acute care hospitals. They say the outbreaks could be related to changes in routine infection control practices.
The CDC says people who get serious infections are usually already sick and hospitalized with other conditions. More than 1 in 3 patients with Candida auris die. Experts recommend you don't be afraid to ask a hospital about their infection control protocols. And most importantly, keep your eyes open and make sure personnel wash their hands each time they enter the room or touch objects that could be contaminated. Doug?
Always makes sense to be your own best advocate when you can.
So anyway, man, there's a little news story. Now I have something else. Where's it? Here's the one from the black fungus that's killing all these people in India.
Welcome back to the news. India recorded more than 45,000 cases of the deadly black fungus over the last 2 months, according to the health ministry, as a nationwide outbreak sweeps through COVID-19 patients. The country's junior health minister, Bharati Pravin Pawar, told Parliament on Tuesday that over 4,200 people had died of the fungus, scientific name mucormycosis. The infection was previously considered very rare, but cases have ballooned during the pandemic, usually striking patients after recovery from COVID-19. It is a highly aggressive disease, and surgeons have been forced to remove eyes, the nose, and jaw from patients to stop it from spreading to the brain. Experts have attributed the recent rise to excessive use of steroids to treat COVID-19. The Indian government declared the fungus an epidemic in May as cases shot up, and social media has been flooded with desperate pleas for medicines to treat the illness.
Wow. Okay, so anyway, they said cutting off nose, taking out eyes, removing the jaw to keep this from spreading. I mean, man, that sounds like some pretty serious stuff. I don't know about you, but I don't want no black fungus. Anyway, that's the story today, guys. Let me see if there's anything else on here. I don't think I read this one. It says a cluster of 22 patients in Dallas area hospitals included 2 patients who were resistant to all 3 major classes of antifungal medications. So yeah, guys, this may be the new thing that we all have to worry about, think about, stress about. Anyway, guys, the new superbug is here. It's going to be fungus now. I don't even know what to say. Just be careful, wash your hands, all that stuff. I'm not a doctor. I'm just here to get the word out about the new fungus problems we're having worldwide, obviously. Anyway, guys, I don't know what else to say on that one. That's crazy stuff. Just be careful out there, ladies and germs. No pun intended. This is the Angry American. Hey, listen, I need you to hit the like button, ding. Hit the subscribe button, ding. Smash that notification bell so you know when the Angry American posts. Comment down below and share the video, because we need to get the word out about this superbug, yo. Alright, guys, listen, man, it's crazy. What a wild time we live in, folks. What a wild time. Anyway, guys, make sure you do those things I just asked, because as my good friend and fellow creator says, Liberal Hive Mind, I am still shadow banned by the YouTube algorithm, hidden from unsubscribed viewers. So, you know, you gotta like, subscribe, comment, and share. Anyway, guys, till next time, be safe out there. Be aware of your surroundings at all times. This is the Angry American saying peace. Peace out.
I'll lead an effective strategy to mobilize true international effort to pressure. True international effort to pressure.
What kind of country we're going to be? 4 more years of George, he's going to find our...
Thank you.